Hi everyone. So today we are going to talk about effects of health literacy about cardiovascular disease among Aboriginal and Torres Strait Islander people living in urban Australia. My name is Akshay Sharma and my group members are Aakruti Patel and Jinal Chauhan. Firstly, we would like to acknowledge the traditional custodian of the lands on which we meet today and pay my respect to the elders past and present. I extend my respect to the Aboriginal and Torres Strait Islander people, colleagues, staff, students who are present here today. Introduction: Aboriginal people were the first people to live in Australia. On the other hand, Torres Strait Islander people have occupied over 270 islands in over 2,500 years. They have survived many challenges in relation to physical, social, and psychological aspects, which had greater impact on their health and literacy. Despite their distinctive ethnic and cultural differences, they have managed to stick together. However, experiences of colonization have led to negative impact on their health. Next, we would like to talk about prehistoric events which have led to the current situation affecting their health. Let's start with pre-colonization. Aboriginal people used to live in societies where men were assigned to work as hunters and women would gather food and look after the house. Research suggests that Aboriginal people lived healthy lifestyle before pre-colonization. Then came in invasion. James Cook invaded Aboriginal land and the first fleet started British settlement in Australia. In segregation, people were removed from their traditional land and were placed on poor quality land. Their access to basic supplies was restricted. Kids were removed from their parents, which is now known as stolen generation. In assimilation, Aboriginal people were expected to behave and live like non-Indigenous people. Children from mixed backgrounds were working as domestic workers on unequal wages. Integration. Finally, Aboriginal people were recognized as Australian citizens and were given voting rights. In self-determination, Aboriginal organizations were formed. They were independent organizations and services and were controlled by Aboriginal and Torres Strait Islander communities, which clearly depicts that they were connected to health services. Self-management. Aboriginal and Torres Strait Islander commissions were formed, which provided essential health services for Aboriginal and Torres Strait Islander people. Reconciliation. Several significant inquiries were held to bring forward issues related to health. Reconciliation began, which showed unity between Indigenous and non-Indigenous people. However, only few Aboriginal community joined in that moment. A new beginning. A formal apology was made by former Prime Minister Kevin Rudd in 2008. It was an initiative to close the gap campaign and was an initiative to change people's perception about or towards Aboriginal and Torres Strait Islander people and their culture. As you can see in figure 5, this is the National Apology Certificate which was made by Australian government in 2008. As shown in figure 6, this is the formal statement of former Prime Minister Kevin Rudd, which was done by him in Australian Parliament in 2008. Perception of health. According to Westerners, health is a state of physical, mental, and social well-being. It is not merely the absence of disease or infection. However, in Aboriginal health, it means not just the physical well-being of an individual, but it refers to the social, emotional, and cultural well-being of the whole community in which each individual is able to achieve their full potential as human being, thereby bringing the total well-being of their community. It is a whole of life view and includes the cyclical concept of life, death, life. Urban. The area which we are focusing on today is urban. The current population of Australia in 2018 is approximately 25 million people, out of which urban population is approximately 23 million people. As shown in figure 8 graph over here, this shows that the population of Australia in 2018 is 25 million people, and in 2018 the urban population, the people living in urban area of Australia is approximately 23 million people. Approximately 88.8% people live in urban area of the total population of Australia, as shown in this figure 8. Currently, the year growth rate is 1.32%, as shown in this graph of figure 8. Urban continued. So as shown in first half of figure 9 over here, it shows that we can see that the proportion of population of different age group. It shows that the population of Aboriginal and Torres Strait Islander people is less in comparison to non-Indigenous people. But we can see that the population of Aboriginal and Torres Strait Islander people is more in age group 5 to 14 years and 25 to 44 years. It is a very positive aspect for the overall development of their community. Now, as shown in this graph or this chart, it shows the distribution of Aboriginal population in Australia. It highlights that New South Wales has the highest population among all of them. The table in the center, this one, it depicts the population distribution in various states and territories in urban, rural, and remote areas. It can be seen that approximately 50% of Aboriginal and Torres Strait Islander people stay in urban area. Health literacy, its impact on Aboriginal and Torres Strait Islander people, and how to improve it. Health literacy has been defined as cognitive and social skill which determine the motivation and ability of individuals to gain access to understand, and use the information in ways which promote and maintain good health. As shown in figure 10 graph, it shows that the literacy rate of indigenous people is low as compared to non-indigenous people. According to research done in 2008 to 2014, the reading and numeracy test has shown no significant improvement in Aboriginal and Torres Strait Islander people literacy skills nationally. How to improve it? To improve the literacy rate, we should build proper infrastructure. We should provide knowledge about healthcare system to Aboriginal and Torres Strait Islander people, and we should raise adequate funds, which would be a crucial factor for improving health literacy. We should avoid racism. We should emphasize on evidence-based treatment, and an inside knowledge about the perception of patient should be emphasized by healthcare professionals. Establishing long-term relationship with Aboriginal and Torres Strait Islander people should be the motto of healthcare professionals. Indigenous people should be provided space where they feel comfortable and cared for and respected. So who is benefiting from all of this? The government initiated the Closing the Gap campaign in 2007, which focuses on many different aspects in relation to Aboriginal and Torres Strait Islander people. The key aspect is ensuring children education. As a result, the health literacy among Aboriginal and Torres Strait Islander people increased drastically. The report Closing the Gap 2017 highlights that 45% of the people in 2008 completed Year 12 and above, while 62% completed Year 12 in 2014 and 2015. Due to increase in literacy rate of Aboriginal and Torres Strait Islander people, A significant decrease was seen in rates of community and family violence of Aboriginal and Torres Strait Islander people. Cardiovascular disease. The health issue which we are focusing on today is cardiovascular disease among Aboriginal and Torres Strait Islander people. Cardiovascular disease is more common among Aboriginal and Torres Strait Islander people compared to non-Indigenous people. The death rate of Aboriginal and Torres Strait Islander people due to cardiovascular disease is 3 times higher than non-Indigenous people. Around 1 in 8 Indigenous Australians had cardiovascular disease as a long-term condition and is more common in women and older people. As shown in Figure 12 graph, it highlights that the risk of cardiovascular disease is more common in Aboriginal and Torres Strait Islander people and is less common in non-Indigenous people. It also shows that male Aboriginal people were 2 times or more at risk than male non-Aboriginal people, and the same can be seen in females. Around 27% of Aboriginal and Torres Strait Islander people are currently suffering from cardiovascular disease, and over half, which is 53% of Aboriginal and Torres Strait Islander people aged 18 or over, had some sort of risk factor for cardiovascular disease. Interventions of cardiovascular disease. A research shows that healthy nutrition, exercise, medication, and smoking cessation are key factors for primary and secondary intervention. A key factor in management of this disease is self-management. A combination of knowledge, psychosocial factors, and skills influences the capacity of a person to manage CVD, which is cardiovascular disease. According to Institution of Medicine, 25 to 30% of ethnic differences in health outcome is due to health literacy. Relationship between health literacy and cardiovascular disease. As mentioned in the previous slide, statistics and information, we can interlink that cardiovascular disease is a condition which can be self-managed, and in order to self-manage the disease, it is very important to increase the literacy rate among the Aboriginal and Torres Strait Islander people, which can be done by promoting health promotion strategies like Closing the Gap campaign. Social determinants. The social determinants of health refer to the close relationship between health outcome and the living and working condition that define the social determinants. Social determinants have a great impact on the health of individual. Lack of understanding about culture, belief, knowledge, and experiences of Aboriginal and Torres Strait Islander people still exist among some non-Indigenous Australians. The social determinants of health can impact a person's risk of disease, injury, and overall health status, as well as their access to interaction with health and health-related services. The two social determinant factors which we are going to focus on today is income and employment and education. Income and employment. In 2011, 50% of Indigenous people aged 15 and over had a weekly income of $362 or less, compared with $582 or less for non-Indigenous people. In 2011, 42% of Indigenous people aged 15 and over were employed, compared with 61% of non-Indigenous people. Unemployment rates were 17% for Indigenous people and 5% for non-Indigenous people. As shown in this chart of figure 16, it highlights that the unemployment rate for uh, the employment rate for Indigenous people was very low as compared to non-Indigenous people living in Australia. Unemployment could be one of the reasons for low literacy rate as it reduces the opportunity for people to study in schools and colleges. The second social determinants which we are going to talk about today is education. The proportion of indigenous people aged 20 to 24 years getting education increased from 47% in 2006 to 54% in 2011. Retention rate increased from 2000 to 2011 as shown in the graph of figure 17. As we have also seen in figure 9, that maximum Aboriginal and Torres Strait Islander people belong to the 4 to 15 age group, which is the time when children start learning and build experiences, which help them to shape a better life in future. This is the time which will help in improving the literacy rate among Aboriginal and Torres Strait Islander people. Protocols. Protocols are principles and guide behavior in a situation. These protocols are designed to protect Aboriginal and Torres Strait Islander people, their culture, and intellectual property rights. The introduction of cultural protocol represents an important step toward understanding, respecting, and representing Indigenous worldview. It also helps in encouraging cultural appropriate working practices and valuing the cultural diversity. Number one is respect. We should always respect Aboriginal culture, Aboriginal and Torres Strait Islander people culture, their rights and their tradition. They must always be respected and protected. Number two is Aboriginal and Torres Strait Islander people control. We should always we should always respect their history, their communities, and their stories and their interviews. We should always involve them in decision making about their cultural heritage and about their everyday life. Next is interpretation and integrity. Representation of Aboriginal and Torres Strait Islander culture should reflect their cultural values, and we should respect their customary laws. When writing about Aboriginal and Torres Strait Islander issues or choosing images to accompanying text, it is important to consider how the work affects the Aboriginal and Torres Strait Islander people and who are the subjects of the story. Their confidentiality must always be maintained. Next is secrecy and confidentiality. Indigenous people have the right to keep their name secret and ritual knowledge in according to their culture and their cultural laws. Next is attribution. Aboriginal and Torres Strait Islanders should be given proper credit or appropriate acknowledgement for their achievements, their contribution, and the roles in the development of the use of their cultural material. Next is sharing of benefits. Aboriginal and Torres Strait Islander people should have the right to share in the benefit from the use of their culture, especially where it is being commercially applied. Finally, legal recognition and protection. The development of Australian law and policies that respect, protect Indigenous right to culture and intellectual property. We should always respect Aboriginal cultural values, their tradition, and we should always um, protect them um, from from outside environment. Conclusion. In conclusion, the effect of health literacy about cardiovascular disease among Aboriginal and Torres Strait Islander people living in urban Australia were discussed. According to the research, health literacy does have great impact on cardiovascular disease. The higher the literacy rate, the lower the risk of suffering from cardiovascular disease. Aboriginal and Torres Strait Islander people are more at risk of cardiovascular disease in urban area because of low literacy rate as compared to non-Indigenous people living in Australia who have higher literacy rate than Aboriginal and Torres Strait Islander people. However, because of Closing the Gap campaign, which the government has initiated in 2007, is helping young Aboriginal and Torres Strait Islander people with many different aspects, especially children education, which will eventually improve health literacy among Aboriginal and Torres Strait Islander people that will, as a result, reduce the risk of cardiovascular disease in Aboriginal and Torres Strait Islander people. Thank you for listening to us. We hope you enjoyed the presentation.